You mentioned that you feel like it's time to stop nursing your 14-month-old son because it's starting to be painful for you, and you've gotten so far, so great job. As for weaning him, it sounds like he's drinking 2 cups of milk a day, so he's getting the nutrition he needs from his sippy cups, and that's great. That's actually a feat in and of itself because kids only need 2 to 3 cups of whole milk each day. But as for the nursing, it looks like he's looking to it for comfort, not necessarily nutrition. He wants it before nap time, before bedtime. And so if you replace that with something else that's comforting to him, then it might make the transition easier as you stop nursing. So maybe you could go to the store and pick out a new stuffed animal, or if he has a favorite blanket, use that, and develop new routines before sleep and bedtime that don't involve nursing. Maybe this can be a story, or just rocking and holding him, or maybe a little song. Turn the lights low, get the environment as quiet as possible, and do this routine each time before nap and bedtime. And if you're persistent for 4 to 7 days, he'll learn that nap and bedtime are no longer associated with breastfeeding. And, he might put up a fight at first, but again, be persistent and he'll get used to the idea of how things are now going to be. Also, it's important if you put him to sleep drowsy but awake, that will help the transition as he goes to sleep too, because some babies like to nurse themselves to sleep, so they need to learn how to fall asleep on their own. As for weaning, when it comes to yourself, the worst thing you can do is stop cold turkey. So if you're wanting to stop him cold turkey, that's okay, but you're going to need to continue to empty your breast just to the point of feeling comfortable again. Not to stimulate your body to make more milk, but just to get enough milk out to the point where you're not feeling engorged or uncomfortable. And so maybe you can get a pump and pump in place of his nursing sessions, and just pump for a short amount of time and eliminate a feeding every 2 to 5 days, and gradually you can wean off of nursing. Your body will no longer feel like it needs to make milk. If at any time during the weaning process you start to have pain or especially develop a fever, it's important to talk to your doctor about it, because sometimes women get breast infections, specifically called mastitis, that needs treatment when they're weaning. If you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.